A healthy smile actually makes for a healthier you. Dr. Charles Martin joins us this morning to explain how dry mouth could be a potential danger to your health. Really?
Yeah.
I thought it was just uncomfortable.
Well, it is uncomfortable.
Yeah. But it's dangerous.
Yeah. The danger of dry mouth, and it's caused a number of people. Some people take medications that'll dry their mouth. Mm-hmm. The second thing that'll happen is if you're a snorer, your mouth will dry out at night. If you're a mouth breather, your mouth will get dry. And the last one is a special condition called xerostomia, where people have a genetic or illness type of situation where their mouth stays dry. The problem with a dry mouth is that the bacteria that try to accumulate on your teeth go hog wild. The saliva, which is a natural lubricant and has antibodies in it, help to stop the bacteria that cause tooth decay and gum disease. And with a dry mouth, they aren't there anymore.
So, wait a minute. Now, I would think bacteria would do better in a wet condition, but it's the reverse in your mouth?
Reverse, because what happens is the bacteria accumulate, they grow larger, and they attack the teeth more basically viciously. So a dry mouth is a danger.
All right, so all right, you set up this danger. You got me scared. How do I protect myself here?
Well, certainly if it's a transient situation, there's not a lot to be worried about. If you're taking a medication briefly and it's drying your mouth, not a lot to worry about. But chronically, then you need to do a number of things. You need to have probably a prescription level fluoride. You probably need to have use an antibiotic rinse to help stop this. And the third thing is you probably need to see the dentist on a more regular basis. Probably instead of every 6 months, probably every 3 months, and then a very close attention to what's going on. And let me add something about that happens with people. A lot of the folks that get dry mouth are seniors. They're older, and they take a lot of medications, and they, for some reason, love milk. And milk in a dry mouth is like throwing a match on dynamite.
You're not supposed to drink milk right before bed either, too.
Right. You're not supposed to drink milk before bed.
Right.
If you do need to drink milk before bed, because it's kind of one of your rituals, at least rinse your mouth out, preferably brush your teeth before you go to bed.
Let me back up the train a little bit. Let's talk about this snoring thing, because you mentioned that is one of the problems. If you are a heavy snorer, some people we know are, how do you avoid the dry mouth and the snoring? Okay. One causes the other, basically.
Well, what's happening when you're snoring is a flap of tissue in the back of your throat is partially blocking your airway. Yeah. Most snorers are also sleep apneic. In other words, they aren't getting as much oxygen as they need when they sleep. In fact, about 17% of the population have some form of sleep apnea. But that's a different story for another day.
Yeah.
For a snorer,
it is drying out your mouth, though.
Yeah, for a snorer, one of the things they can do is they can apply fluoride to their teeth before they go to sleep.
It'll keep that bacteria from
It'll help strengthen the teeth and kill the bacteria.
Okay. All right. I learned something with you every time.
I'm glad.
I'm going to find out something. All right, we got information here. This is a before and after picture. And again, that went away awfully quick. But that was a great looking picture. Big difference there, too.
It was a big difference.
All right. Well, Dr. Charles Martin, we always enjoy having you here and always learn something, too. There it is. Sorry, it slipped away there for a second.
All right,
we're back. A real quick story about this gentleman?
He had a retired executive, had somehow never gotten time for his teeth and wanted to be put back together again. I think you can see a great result.
Fantastic story.